So I'm Alice Finari, and I have the privilege of being here today with Lisa Gonzalez. And of course, we have a new library, not a new librarian, but a librarian who's new to this project, Liana, who will be joining us with bibliometrics for our slot for our articles. So thank you for becoming part of our team here. And I just want to say this is a topic that I didn't know anything about until I had a conversation with Lisa Gonzalez, who's one of the speakers today. And she comes from a really interesting background because she's trained as a veterinarian and an MD, and she has an MPH. So she's like the perfect person to talk about One Health.
Wow.
And well,
Go
must
ahead.
say I'm excited. And when I didn't know anything about One Health, and we got friendly a little through our work in ethics, and Lisa will be joining the ethics team, the clinical ethics team, and hopefully, if she ever gets through North Shore credentialing, will work at Staten Island Hospital as an ethics fellow. So that's how we met about ethics. And then she told me about this One Health thing. And I'm like, well, maybe we should look and see what's happening in health professions education. So as I said, I'm pretty excited about today because I'm learning about today. Really, I'm here as a learner more than a leader. So whatever I'm presenting to you, I'm going to be transparent. I learned for the first time. So I'm far from above anybody else in the audience. And if anybody in this audience knows a lot about One Health, please share it with us. So I'm going to share our screen and get started as Lisa's here and I'm here. And then we can, of course, open for discussion. So let me just get my screen share on. And, we had two really good articles on this topic. So I do feel it's relevant to our discussions, even though it's not something that's maybe front and center in the current medical school world. So we're here to talk about One Health. And as I said, Lisa is more than trained to do this. And I met her through our healthcare ethics consulting world, and she's very involved. So this gives you a signal of what we're talking about a little bit, this little diagram here, humans, environment, and animals. And we have two questions, and then I'm going to let Lisa take over. But did anyone else ever hear of the term One Health that you're here? Just this is open mic for all of you.
Yes, and I include it in HMI, so we teach it to our students.
Okay,
This is
great.
this is taught in the second year, just not in a huge way, but they hear about it in a pre-work video and in two large group sessions we cover it.
Great. That's so good to hear. And I didn't even know that. So thanks, Joe. And so what do people understand about the term One Health? When you say it, Joe, since you have a little bit of experience, like what are you capturing when you say we're going to talk about One Health?
So what I try to get across to the students is I ask them to think about emerging infectious diseases, the most, COVID, like it's the most obvious thing to do. And then I ask them to think about how would you attack an emergent infectious disease holistically in terms of integrating the different disciplines. Like what kind of disciplines what kind of specialists, if you will, do you think need to be involved in surveilling, developing treatments for whatever aspect from surveillance to treatment, like what types of people do you think need to be involved? And I try to get them to think about veterinarians, public health people, virologists, bacteriologists, not just the clinical pieces, environmental microbiologists, et cetera, et cetera.
You mentioned COVID-19. Do you think COVID-19 brought this idea more forward, One Health, or you don't think it
I,
is?
I don't, I don't know. I mean, I think it's kind of been under the radar of a lot of people for a long time. And yeah, so.
Okay. Anybody who works globally at all think about One Health that you want to comment? Okay. Because I think it would have relevance in global health work for sure. I was just thinking about my time in Guyana that I went for a week last April. It's actually a year ago already. Crazy. Oh my God. And thinking about the One Health concept there in Guyana, we're doing some work I think really, really relates. So I'm going to let Lisa start and then I'll do a second article. So we have two articles today. Lisa, you ready?
Yeah, no, thank you so much, Alice. So, as Alice mentioned, I do have a DVM and an MD. I'm foreign trained, and then I came here and did my MPH, and then I also have studies in clinical bioethics, and I'm certified as a healthcare ethics consultant, and hopefully coming on board as a ethics fellow, credentialing pending. So when Anne had this opportunity, I thought this was great for me to get more practice and really presenting. And so the article that I'm going to be presenting on is Shared Curricula and Competencies in One Health and Health Professions Education. And this was an article written by Dr. Larson. She is Department of Veterinary and Biomedical Science professor, and she's been doing this kind of work since 2017. So the learning objectives of this article, sorry, I thought we're going to go over a broad overview of what One Health is, implications at the patient level, and then implications at the policy level.
And I just want to say, as I said, I think I'm a novice in this area, but if there is anybody who has some experience with this topic, please feel free to, when we chime in, asking questions, to speak up.
Thank you. So I do have some experience in this area, and Anne has always been very supportive in me, present. So One Health, defined by CDC, is really a collaborative effort. It's the relationship between humans, animals, and the environment. But it's really how do we work together, coordinating, communicating, collaborating, and really get out of that siloed mentality. We really need to kind of get out of our own speciality and reach out and work with other people to really look at things more holistically. And so, again, One Health is a collaborative, multisectorial, and transdisciplinary approach working at the local, regional, national, and global levels, where there is an interconnection between people, animals, and their environment. And so this article, Dr. Larson posits in her article that fundamental courses like gross anatomy can be a uniting thread so that we can start to incorporate some of these competencies in the curriculum to teach health professional education. Go ahead.
I thought that was really interesting how anatomy was a way to do this. So I thought that was really interesting. And there is a link here to the CDC website, and this PowerPoint will be on my website recorded. But anything you want to know about One Health, CDC has some nice material.
Yes, so this article has a very interesting chart or figure where it really goes into historical context of One Health. And as medical students or medical professionals, we do the Hippocratic Oath, and we see here from 400 to 100 BC on this time chart, Arabs and Greeks, Aristotle, Hippocrates, integrating medicine. And then you can go into the timeline, Leonardo da Vinci with comparative anatomy from 1400, and over here Virchow with zoonosis, right? The father of comparative anatomy. And so you can even go One Health approach led scientific discoveries in comparative anatomy, physiology, and pathology. And if you're an ethics, buff, it's not in this chart, but you know that Potter was one of the founding people that termed bioethics. And it's really, it's not a siloed approach. It's really, holistic, where environment and animals are included. So that was just the historical context, very interesting figure. Any
Right.
questions or go ahead,
I
Anne.
think that is interesting because we don't really sometimes study that much about the history of medicine. So thinking about the history of this as a combined, as we say, multidisciplinary approach, is that it's not a new concept, but it certainly, maybe at certain points, has gotten lost. So when we think about some of these diseases here with smallpox and vaccines and how we have used animals in many ways to help some of the discoveries, I think is interesting.
Absolutely. So this other figure in the article talks about the shared competencies in health professions. And again, we're looking at this collaborative approach. And here in this article, we highlight problem solving, team collaboration, communication, systems thinking, values, ethics, professionalism, management of teams, diverse teams, cultural competence. You know, it's really getting outside of our siloed thinking and really thinking more holistically. So I think this is a very interesting slide. I think this reflects a lot of the work that I've done in the past. Evidence-based practice, ethics, values, professionalism. And I think these are shared values that we all as in health profession, we want to embody. So I think this is very interesting if anybody has
So
any.
in medicine, we've heavily focused on AAMC and LCME. Constantly, we focus on what they say, the LCME, in terms of planning our medical curriculum. And interprofessional collaboration and teams are important. Medical ethics is important. Population health is important. And then we don't really think about this converting into the One Health concept. I put a red around this so you could see the common themes that come. And of course, this is veterinary accreditation, which I'm obviously less familiar with. So I was just wondering, Lisa, since you were trained in both the medical model and the veterinary model, do you see the overlap that's mentioned here, the common themes? Do you see that in that?
Definitely, definitely. It's very similar. It overlaps, and in comparative anatomy, definitely. But even when you're doing your clinical history, you know, animals can't talk. So you have to go specifically with just their back with the clinical history and the physical exam. Now humans, they can talk, so they can, you know, speak a little bit more about what their symptoms and so forth are. But it's very, it's medicine, except that veterinarians do, you know, animals instead of humans. But
Right.
very common.
So I sort of asked this question already. I forgot I put it in the slide deck. Does anybody want to talk about their knowledge of competency-based medical education wherever they work and think about sharing some of the competencies of One Health that are here and talking about them? Does anybody want to comment on that at all? And maybe, has anybody done it? Has anybody brought, besides Dr. Willie, she mentions what she's doing in her interacting with the environment course, which is a perfect course. Any of the other people who are working in public health that are on this call, thinking about One Health as a competency in the public health arena?
So I just want to mention also, I do not work in the education field. I'm not a professor. I can only speak from my own experience, but there's a lot of attention with One Health and antimicrobial resistance. And so I think that's something that a lot of the physicians would be more familiar with.
Elizabeth, do you have something to say? I see you
Yeah, I
raised.
would like. Yeah, thank you very much. So very briefly, I'm just kind of finishing off and finishing off a thesis with my PhD student, and he's working in interprofessional health in terms of disaster management and responders. And there is so much that you need to be aware of the animals, of the environment, of the diseases that people bring in, especially when you go in different environments. So I think it is a huge and very important topic, and especially of awareness that most of us don't have because we're bound in our own framework, right? So I believe adding this into any kind of curriculum is a very, very important mandate.
Right. Definitely. And I know you're a microbiologist by training as well.
Yes.
You're in a
yes.
you're in a new medical school offshore. Is there any touching of One Health as a concept yet that you've seen at your medical school?
Well, it's not yet as a concept. However, we have international students and we have local students from the Bahamas. And all the teaching that we bring in, they cannot just be transplanted into another culture. You really also have to be aware, how does a certain disease manifest itself in the Bahamian culture, right? What do we need to teach Bahamian students that they are not aware of? Or we also do public outreach, right? And teach For instance, melanoma awareness. I mean, just as an example, right? That is completely undertaught and a big problem, which is not infectious diseases, but you have to be aware, in wherever arena you go, that it's a new environment and it is very important. And yes, we are building this awareness.
Right.
Wonderful. I have a question, Alyssa. When you refer to Bohemian, what are you referring to? Sorry.
Bahamian.
Sorry?
I think you were saying Bahamian culture from the Bahamas.
Bahamas, from the Bahamas.
Oh, okay,
Yeah,
from
from the Bahamas.
Bahamas.
Yeah, yeah. Well, thank you very much. So it's an entirely different environment. It is actually low resource and hurricane ridden. So a lot of knowledge is missing, a lot of outreach is missing, a lot of needs are there. We have awareness center for mental health, for general health, right? And this is new information that we get that our students also learn. It's awareness building, it's compassion building, sensitivity building with the diseases that we see. And I noticed when I teach my local students the diseases, for instance, the fungal skin diseases, right, that they will teach back to me how it looks like in their community and how they deal with it, right? And they have to build this awareness. So in order to really be a part of that. So thank you very much for presenting that today.
Great.
Thank you. And what I want to add to that, Alyssa, is also not only medical students, but even community health workers. When you're talking about at the patient level or at the community level, yes, we need our medical professionals, but we can definitely start teaching the community health workers because they work more closely with patients, with the people. But that's a great way to start sensitizing them to certain diseases that maybe people were not aware of, but a community health worker would be easily more apt to talking about it, like what you were saying, a fungal disease.
Right.
Or a dermatological disease, or so definitely. So anatomy as a uniting thread. So this article, Dr. Larson talks about how we could start teaching these competencies through anatomy. And so this chart really just goes over where's the overlap, and where they saw most of the overlap was in clinical anatomy. And I think it's pretty straightforward. And it talks about who gives these classes: DVMs, PhDs, or graduate medical students.
So why do they feel clinical anatomy is the place to talk about this? I'm just trying to understand the connection myself. Obviously, I'm not an anatomist, but
Well, I have not specialized in comparative anatomy, but there's a lot of overlap between human anatomy and different animals. So I know that in veterinary school, we use dogs as kind of the basic animal to do anatomy courses on. And believe it or not, the vertebrae are the same. We have 7 vertebrae, let's say in a human, and in a giraffe, you would think there's different number. It's actually the same number. So, I mean, physiologically speaking, too, mammals are very much similar. And look, we're using pigs to do, transplants. We're actually, yeah, I can see how the beginning of anatomy, like when we're learning these first basic anatomy courses, they do overlap.
right. I never thought about that. Is there any anatomist on? I just wondered if we had an anatomist on by chance. I'm not pressuring anybody, but just thinking about the overlap with One Health and anatomy as a uniting thread, as posed in this article.
So I think what she wants to do, and sorry, I know you're asking the audience, but
No, but that's okay.
It's kind of fostering that interdisciplinary understanding, where the differences or where are the similarities, and really beginning to look not just at what we're studying, but kind of look a little bit outside of that range, but at the same time finding where do we overlap. And I think that's what she wants to convey with this article.
And is this an implication that Tufts and Penn is doing this work? Is that what these are here?
Yes. So these are the 2 universities that are currently doing this comparative anatomy, Tufts University and University of Pennsylvania. Tufts has a comparative anatomy exchange day, and they also have an interprofessional Tufts One Health event. And University of Pennsylvania, they have a Penn InterHealth School Anatomy Exchange. So they're really starting to work towards, fostering that interdisciplinary understanding.
And it's interesting as we think about transplants. I have not really thought about this, but using animals as sources of transplant for humans, is that something that's going to be more of in the future, you think?
We're already seeing it using fetal pigs, but I'm not even going there. That's a whole nother
And
that's a whole nother topic.
overlaps with our ethics.
Exactly.
Big overlap with ethics and ethical decision making, but I'm just thinking because there is a shortage of specimens for transplant. So certainly, I don't know what the future will bring.
So this slide and in the article talks about how can we start incorporating One Health in the medical schools, where we see many medical schools actually start at the student level, where they will start a One Health club. And so ISOHA is an International Student One Health Alliance, and they support student clubs of One Health. So this interprofessional education supported by International Student One Health Alliance. So, as the schools or students form these One Health clubs, they can really focus more on educational activities to bring learners together. Where they are focused on shared concepts and experiences. These things are best carried out in small groups, and it's almost like what we're doing here, right, with a journal club. Simple and repeatable, highlights similarities among various health professions. And so the International Student One Health Alliance really supports these One Health clubs at these different universities.
So it's interesting. We're trying to connect, and we have a new veterinary school on Long Island, which I wasn't even that aware of till recently myself. It's around the corner from Hofstra, basically, not far away. And Joe, do you think there's any crossover between the veterinary students there? And that's brand new for us to have a veterinary school.
I don't even know what vet school you're talking about.
I
Who has a vet
know.
school? Who has a vet school?
LIU.
Oh, I think I did hear about that. Yeah, well, that's what I was thinking when Lisa was talking about Tufts and Penn. I was thinking, well, they have two of the best, at least on the East Coast, if not in the country, two of the best vet schools.
Yes. Yes.
I mean, that would really sort of grease the wheels.
Right. That's what made me think about. I know somebody who applied there that I worked at LIU for 20 years. So this is like unbelievable that they
that's
have
really interesting. Yeah, maybe we should
and we don't know that there's not some way, to cross over, because that's really very, very close to us, the idea of interprofessional education with the veterinary school there.
Yeah.
I don't know much about it, but I'm sure there are people there, who are trained. Lisa, did you know about that new veterinary school on Long Island?
No, I did not. No.
I know, it's like a secret.
It is a secret.
That's wonderful. I mean, I know Columbia has a One Health Club. I know that Cornell does, but I don't know if they weren't mentioned in this article, so I'm not going to bring them up. But there's a lot of work being done in One Health, and I was surprised that there isn't more work being done at Hofstra with One Health, but maybe there is, and I'm just not aware of it. Especially, because of COVID, I think it brought a lot of attention. So
Corinne's on the call. Yeah, Corinne.
Hi, I'm here. Yeah.
Yeah. Are you guys doing anything with One Health?
Yeah, I was asking that.
Yeah, I mean, I heard before, and I think it's a lot like what Elizabeth said. There's certainly increased discussion about it in epidemiology, in our environmental health courses, particularly since COVID, but I think we brought it up even before then. But I don't think it's yet embedded in any of the competencies. I don't think it's reached that level. And I think there's certainly potential for that. And I also love the idea of exploring possible collaborations with LIU's vet school. We actually have our first veterinarian in the MPH program.
Oh.
He comes to us from Nigeria. and he was involved with WHO and their One Health programs. And so he's
Yeah.
brought a lot of learning into the classroom, and into some of the research projects. And I think we're primed for kind of doing more around it.
Yeah, we should talk because we have a group that comes over from infectious disease and does a whole 2-hour session on antimicrobial resistance, and they start off the session with One Health. That's one of the sort of touch points throughout the course. But we don't have anything organized, so
Yeah.
we should think about this.
About
All
it.
right, we're hijacking things. Lisa.
No, I'm happy. I'm happy you guys.
Fine.
No, this is wonderful. And Corinne, I would really love to meet the vet MPH. If you could connect me, that'd be great. I'm working at I volunteer at American Public Health Association, their One Health section. So we're always looking for people that are working in One Health and how to promote that work. So it'd be a great contact for me to just, talk and see what's going on.
I would love it. I think he would love it. I was hoping Pindar would be on the call today. I don't see him, but yes, I'll introduce the two of you. Thank you.
Thank you. Thank
And
you.
maybe you can spotlight him in one of your newsletters.
Absolutely. Absolutely.
Mhm.
Lisa's running a newsletter for the One Health area, Corinne.
Oh, that's great.
Well, I'm not running it. I'm one of the associate editors, but yes,
Okay.
I would love to highlight his work if that's possible.
Excellent.
Alyssa, you have a question?
No, just adding in, if you have some interesting, if you would like to get some input, from us from the Bahamas down there in the subtropics, so let us know. That might be interesting as well.
Thank you, Alyssa. I would love to connect, definitely.
So this is overcoming barriers, Lisa?
Yes. So I think that we are all thinking, how do we incorporate all of this new curriculum? Because I know that the curriculum is probably already packed. So in the article, they talk about different strategies you can use to kind of overcome some of these barriers and leveraging technology to facilitate learning. And I thought this was great, especially like during COVID, how we use Zoom and we were all communicating online. So they have different video conferencing platforms that she talks about, like Zoom, Microsoft Teams, Google Classrooms, and then also like polling applications, virtual anatomy applications. I wish I would have had these resources when I was in medical school. They have these 3D applications of the glass horse and dog. It's called the Visible Body Biodigital Human, where you see these anatomical structures at 3D level. I mean, I don't know how anyone cannot get an A when they have these resources available to them. And they also have 3D printing to be able to dissect different organs. Now you can do these 3D printing. It's really amazing. So I invite you to read the article. I'm not trying to do a commercial for these different platforms, but I think it's really amazing the different technological advancements that we have to help with, education. So those are just some of the things that she talks about in her article to facilitate that, interdisciplinary learning in anatomy.
Right. And today this is important with students.
Definitely. So again, the educational strategies is really to emphasize that active learning, problem-solving skills, fostering awareness of transdisciplinary sciences and global health perspectives, to develop professionals equipped to interact with diverse communities. And when I want to so at the patient level, we're saying, okay, we can educate our students to be more mindful of these interdisciplinary areas, right? But at the policy level, once to have behavioral change, you starts at the individual level and then it goes up the tiers up to the public policy level. It's not an up-down approach, it's more the down-up, from the bottom-up approach to really have that change. So if you are in public health, this social ecological model is very common to you. You're probably very familiar with it. And that's what we really want to do, is really how do we influence change? And it starts with the individual until you really reach that policy level. So I want to stay just confined to the article, because this is like an article review that we're doing. But I do want to say that there's a lot of work that's being done at the policy level to really promote this interdisciplinary, collaborative approach to health. And but I put that in the resources so that on your own time you can go and do a little bit more reading on One Health. But it is something that is getting a lot of attention at the policy level.
And certainly this model relates to medicine, individual, interpersonal, organizational, community, and public policy. So this is certainly very applicable as an ecological model in the world of medical education, which is, of course, where I sit, or health professions education, I should say. So this is certainly an applicable model.
Oh, okay. So this is the conclusion. Let me just bring it up because it's kind of broken on my screen. So yes, One Health is the underlying theme for our health professionals education. The framework emphasizes the need to better understand connectedness of humans, animals, and the environment. And a shared framework will allow early and meaningful interactions for each other to better understand diverse perspectives, which ultimately influences abilities to provide global health care. That is what I conclude. Well, that's what Dr. Larson concludes with. And I'm very happy that I had the opportunity to present this article to you. And I believe Anna's going to present now on the second article, which goes into a survey.
Yes, I'm going to do this. I'm just trying to see the time we have, which is, okay, we're good. So this is a survey of One Health programs in U.S. medical schools and the development of a novel One Health elective for medical students at Georgetown, which of course is a prominent medical school in Washington, D.C. So the way they did it, what they're talking about here is they had an elective that they established, and this is the course content of the elective. I'm not going to read all this to you. Obviously, this is all from the article. So they started off with an overview with guest lectures and discussions, because you do need guest lecturers here because you need such a I love that word, transdisciplinary team. So you can't have one person doing this. So that's what they started with the overview. Then they did a case study, which I think is interesting, and that was pet associated. Somebody else can comment on this word. Maybe Joanne knows this better.
Campylobacteriosis.
Thank you,
It's a GI.
Thank you. Thank you so much. So a case study and a pet associated of that, and obviously. And then they did some current event type things, presentations, and listen to a recorded lecture. So bringing in some experts, and then had small group discussions. And then they did a virtual zoo tour, which I thought was fascinating, where they actually went on a virtual zoo tour. Now, Washington has an amazing zoo. Wasn't sure why they just didn't go in person, but maybe it wasn't feasible. So they did a virtual zoo tour. And then they had some immersion experiences where they did climate change and the practicing clinician, and discussed experiences with health and harmony, with some work that was going on. So this was central to their local, work that was going on. So it was really an interesting, diverse elective with many pedagogies, from traditional to case studies, then some current event. They had a simulation exercise. I forgot to mention the zoo tour, to me, is what hit me because I love the Washington Zoo, and then some immersion. They picked topics as emerging infectious disease, zoonosis, vector-borne diseases, epidemiology, emergency preparedness, which Elizabeth mentioned, the human-animal bond. And we're using animals a lot for empathy. There was animals on resident recognition day. They brought animals into the hospital for the residents to interact with. So obviously the human-animal bond is big. Of course, some facilities allow animals to come in to bond with residents, be it rehab or long-term care facilities. So, and even on the Children's Ward at Cone Children's Hospital, they've used animals to work with the kids and, relieve some of the stress and bring some happiness. So this is certainly there. And we're just understanding the effects of climate change on public health. The 21 participants were surveyed before and after the course. I thought that was admirable that they had 21 take this. for their knowledge and understanding of One Health. And a 2-week One Health elective is what it was for third-year medical students. So that's a setup, 2 weeks, pre-post survey and topics. So this is some data. These are survey responses before participation in the elective. So this is with no knowledge. We're asked to rate the value of early warning, epidemiology, emergency preparedness, and coordination of communication. And this, so obviously they all felt this was very important, early warning and detecting. Of course, we just went through COVID. Epidemiological investigation, coordination of communication. This is important for disaster planning. And then 80 emergency preparedness and response. So it was pretty high. This is before. And then they were survey responses before participation were asked to rate the value of the One Health approach. Now, this is before they had the elective. So you could see here, patient-centered care was a little low, drug discovery a little low, less than 50%, improving public health. So they, from One Health, they got that right away. And then emerging disease outbreak, that seemed to really hit home to them as very important. And this, if you look at this, these are questions that you should ask when you're doing the clinical intervention. Does the patient have pets? Are these pets up to date with vaccines and parasite checks? And this costs money. So depending on your socioeconomic and your social determinants of health, every patient might have pets. Don't think it's a barrier to having pets. Many people do. But are they up to date with vaccines and parasite checks? Okay. Travel history of the patient. Has there been any major changes in the environment? In other words, have they changed their environment? Does the patient hunt? I have to say, I've never seen this question asked to a patient. Do they hunt? This would be a new question for us. Does the patient spend time outdoors? Well, we encourage people to spend time outdoors. So this is an interesting question. And if so, where? We know that Long Island can be tick infested, obviously deer ticks, and that impacts animals as well because the animals can get ticks. So this is an important question on Long Island. Does the patient have any exposure to agricultural animals? Well, farming is big in the east end of Long Island. And does the patient consume any raw meat, seafood, or unpasteurized dairy products? The raw meat and seafood, obviously, we eat sushi, a lot of us, so that's interesting. And unpasteurized dairy products, we don't think about, but I have one of my children only use unpasteurized dairy products, only.
Ooh, not good.
I know.
Brucellosis. There's a few different, foodborne diseases.
And this is a comparison of students' responses on the importance of coordinating this before and after. So they obviously increased in the after of how they felt it was important. And this is a comparison of the responses regarding relevance of One Health to their future career. This is as a medical professional before and after. And it was, quite low before and got higher after. So obviously, there was a positive impact of introducing this content to the medical students. And I just wanted to point that out as we think about curriculum reform. What was most interesting to me, of course, as a qualitative researcher, I love qualitative research, was before the course, I'm not aware of the term One Health, but I think it has to do with the connection between our health and the living, non-living world. Based on my limited understanding, it is an attempt to create optimal outcomes for all while taking into consideration not only humans, but all the other living organisms and nature. I never heard of the term before this course. And then when you go after the course, the intervention between humans, animals, plants, and everything else on the earth, and how our interactions impact one another with a particular focus on human and animal health. One Health is the idea that animals, the environment, interplay between the two and have a significant impact on human health. So obviously I'm not going to read all of these to you, but there was definitely an increase in the baseline, this was an awareness call, base knowledge course. This was not an advanced course, but they obviously had a positive impact on the medical students' learning. So they also surveyed medical school curriculum across the country, and these are the questions they asked. I'm not going to go over the data so much. You could look at the article yourself, but I thought the questions were interesting. Within which year is One Health Matter incorporated? So Joanne could answer that for us. Maybe she was surveyed. She does that in our second year course, Interacting in the Environment. So where is it incorporated? What type of curriculum? Which years would be preferable? Where in the curriculum is preferable? What types of curriculum is preferable? And which approach do you think would be most effective? So some people felt extracurriculums, felt in the curriculum, immersion, interprofessional active learning came up. Immersion came up, quite of research opportunities, but, there could be. And then over here, so I think that was the last slide. So most medical schools have their rotation set up, so it would really have to be integrated into a required clerkship or be an elective like they did. So this is just a conclusion on the elective, particularly. So participating in the course enhanced their knowledge and the students' perception of the importance within the curriculum and might change their future career approach. It's evidence that integration can achieve a new level of learning and at a low cost. It was an elective and a more holistic approach to health that takes care into consideration the environment, wildlife, and domestic animals can close the educational gap that was identified in the surveys. So I think, there's agreement. This is a good elective to have. I don't think we currently have one. And Leanna, do you want to go on now with the two articles?
Sure. So this is the metrics for Alice's article, the survey article. If you look, the first little badge on the left-hand side is the Altmetrics score, which is like a measure of bibliometrics outside of traditional citation counts. This article has gotten quite a bit of attention. It's been picked up by one news outlet. Has been shared 11 times on X, mostly in the United States, which makes sense because it's a survey of US medical schools. And most importantly, it's been shared on, it's been saved on Mendeley, which is a reference tracking software to a citation software also. And so basically, if someone saves something on Mendeley, they're intended to go back and read it again and possibly incorporate it into their own work later on. It's also been cited 8 times in Scopus, and the rest of those numbers are from Plummetrics, which is another altmetric company. And it's also been shared several times on Facebook and commented on. So it's really gotten a lot of discussion in the community, it seems like.
And this is the first article.
Yeah, the same basic statistics.
That was the second article, right? The one about the survey.
Yeah. Mm-hmm. Yes.
This is the first article.
And this is the one that you discussed, Larson's shared curricula article.
Oh.
It was shared a little less widely on social media, it seems. Interestingly, the one person who retweeted, or I guess, I don't know what the verb is for X now, was in Belgium, which is kind of unusual. But it also had 6 citations and a pretty large number of Mendeley saves.
This is interesting that normally we get a map that looks like this. So this is, very US centric.
Let's switch it off.
I think it's very interesting that Canada is not this is Canada, right?
Yes.
Yeah, so Canada is not represented on this because it was US medical school. So I guess they weren't interested. Because many times Canada is interested in stuff that we're interested in, but I guess this was so US centric.
So I think this is great. I really appreciate these bibliometrics. Thank you, Leanne. So I guess the shared curriculum, the article that I presented on did not get that much attention, but it's good that we went through it. We learn a little bit from everything that we read. But I think in the future, probably we would want to present on something that has more reach. I'm thinking maybe, but I thought it was interesting, especially with her with the technology piece, and because sometimes technology is hard to kind of implement. It's hard to start up. So I thought that was interesting. That's why I wanted to present on that one. But yeah, this is great.
Great. So I was wondering, One Health, and this will be our concluding discussion. We have UME, we have GME, and then CPD, which is continuing professional development. And I've not seen anything in my attention to CPD on this topic. So if we don't educate the practicing people, be it veterinary, I can't speak for veterinary, but in medicine, how could we expect to influence undergraduate and graduate medical education? And should we be pushing some of these questions that were in the Georgetown article as standard history questions that we should be putting into our histories? Any thoughts?
I don't know that much about One Health, but it seems like some of it's maybe applicable or taught already in parasitology and infectious disease. So maybe that might be a good place to insert it. I just did a quick search because I went to St. George's, which has a vet school in it. It's a Caribbean school in Grenada. And they offer a One Health, One Medicine class, but it looks like it's just for the vet students. It's an elective. It's a seven block module. So it's definitely something that is interesting and needed. But for the med school, I would just say incorporate into the ID section.
And do you think that at St. George they're connecting this at all, since you have a vet school and a med school there?
Well, that's what I'm saying. It's interesting that the vet school definitely has it. I mean, it's all on one campus. But I don't know if they offer this class to the med students, it's elective, or if it's incorporated into their, ID block. I'm going to try and find out.
So I would say for a CPD, it's probably right now just happening in the infectious disease division. Certainly all the infectious disease physicians that I've interacted with are very aware of One Health and of the One Health initiative and understand its importance. In terms of sort of broader reach across disciplines, I think if not for COVID, there would be not that much interest, but I think maybe now people are a little bit more attuned to, that this is where the next pandemic is going to come from. So, should we be worried that cows now have avian flu?
Absolutely.
This is a thing, guys. And I think at the UME level and the GME level, I think that there's, again, this is one of those topics that I think it's ripe for multiple touch points. Introduce it during the infectious disease course, which is what we do here. There may be opportunities with curriculum renewal to develop I'll call it an elective, but one of a suite of electives from which students have to select, X number from, so not completely elective. Say like a suite of electives that students would have to pick 3 or 4. We're still working on that, but we're looking. The idea with those courses is that they're integrative, they're higher level, and I think that this, depending on how you present this, it could be, it could be all those things plus interprofessional, which I think is really important. So I don't know, Corinne, maybe we should talk. And Alice, if you know anybody over at the vet school.
I don't.
You don't? Okay, well, I guess they have a website. It's always a good place to start. See what's what.
I think, it's interesting because we try and do interprofessional education, and certainly this could fit in. So that's another place.
Mm-hmm.
Our next journal club is our last one for the season. I don't do June, July, and August. I take a break. And this one is on forum theater, which is totally opposite of what we're talking about today. A diagnostic tool and intervention for difficult professionalism issues. So this is going to be really interesting. And actually, this is done by this woman who I met through the Association of Professionalism in Healthcare, and she did her research project on this. And a really interesting project of combating the barriers to difficult professionalism issues which we all encounter. So that's May 1st, our last one. It's around the corner, 12 to 1. And look forward to seeing some of you there. I'll be, PR is out on that. So I want to thank everybody. I'm going to end my show.
Yes, the Alice Pernari show. Woohoo!
I put a link to the survey in the chat, by the way.
Oh, you did? Thank you. I
Yeah.
was gonna
Thank
do
you.
that. You're ahead of me. I love that. I'm going to stop. Anybody have any last comments before we close out? I want to thank everybody who came today to learn. This was truly a learning experience for me. I really do not know much about One Health, so I was happy to have Lisa with me. Thank you. Thank you.
Thank you,
And
Alice.
Thank you, Leanna, for your first entree into Journal Club. And thank you for, learning together.
Yeah, thank you, Lisa.
Thank you, and thank you. I'm a lifelong learner, so I appreciate these opportunities to share ideas, and hopefully, maybe there'll be a One Health elective or incorporate that into curriculum. I'd be so happy to be a part of that. So
Yeah,
thank you.
yeah, yes, of course.
Thank you.
you.
Thank you so much. This was great. I look forward to follow-up conversations too. Thank you.
Absolutely.
Okay, thank you for all who included. Thank you. Bye-bye.